we have our hotline, which is this 800-686-1578. You see it up there on the screen. You see it right there, 7:30 to 5, Monday through Friday. That is answered in Columbus by human beings. Human beings in the same state that you live in. There are 21 folks who answer this particular hotline. I know them all. All right, I know everybody who answers it. So when I say they are humans, I can confirm they are flesh and blood human beings in Ohio who are there to help with whatever it is. And it can be as simple as, hey, you know, I met Dave on Tuesday and I had a question about this or that, all the way to, it's open enrollment time right now. I want to look at my plans for next year, possibly make some changes, or you folks who are new to Medicare, hey, I'm new to Medicare, it's coming up, I want to go through what I need to do there. Good morning, everybody. As Mandy said, my name is Dave Painter. I am with the Ohio Department of Insurance. My department within the Department of Insurance is called OSHIIP with a P. Hit the P when you say OSHIIP. As you see right there at the front of the book, Ohio Senior Health Insurance Information Program. We are one of 54 SHIP programs. All 50 states have one for U.S. territories. Here in Ohio, we are part of the Department of Insurance. We are tasked with providing Medicare information, Medicare assistance to consumers. We do it a number of different ways. We have the white book, like we handed out, and I do have extras if folks want more of that stuff. Did anybody not get one, though, on their way in? Everybody's good, cool. We have that. We have speakers like myself. We're a very small group out of Columbus that, as far as the speakers go. We are actually, this year, we expanded to 6 folks. But then one of them very selfishly had a baby this month. So Hannah's not here today, you get me again. So actually we're technically 5 right now, but we should be 6. We have our hotline, which is this 800-686-1578. You see it up there on the screen. You see it right there, 7:30 to 5, Monday through Friday. That is answered in Columbus by human beings. Human beings in the same state that you live in. There are 21 folks who answer this particular hotline. I know them all. All right, I know everybody who answers it. So when I say they are humans, I can confirm they are flesh and blood human beings in Ohio who are there to help with whatever it is. And it can be as simple as, hey, you know, I met Dave on Tuesday and I had a question about this or that, all the way to, it's open enrollment time right now. I want to look at my plans for next year, possibly make some changes, or you folks who are new to Medicare, hey, I'm new to Medicare, it's coming up, I want to go through what I need to do there. However you deal with us, oh, I'm sorry, I jumped one step ahead of them. What if I don't want to do it over the phone? What if I don't want to talk to some voice over the phone? I actually want to meet with someone in person. Okay, that's where Amy and Mandy come in, who are hiding in the back. They're staff members here at 50 North, but they actually have taken a Medicare certification training. They get update training every year. They are folks who you can actually meet with one-on-one. You can actually make an appointment, sit down with them. They'll go through the same sort of information if you'd rather do it that way. And our hotline is year-round. This is not an open enrollment deal. Our hotline is year-round. These ladies are available year-round as well. Okay, so if it's something where it's not an open enrollment issue, just call over here to 50 North or even stop at the front desk and say, hey, I want to make an appointment to talk to someone about my Medicare. You do not have to be a 50 North member to make an appointment meet with one of those folks. If you are, for example, not in Hancock County, you drove down from Wood County or whatever, and you're like, hey, I wonder if there's something like that in my area, again, call us on the 800 number. And we can look that up and tell you who's in your area. We can tell you who's in your area. Good enough. However you deal with us at OSHIIP, just know that all of our information is 100% impartial, meaning we have nothing to sell to you. We are not trying to steer you one direction or another. The open enrollment's going on right now. Okay, as we film this, it's November 18th. We got a couple weeks to go. Those of you who are Medicare eligible, whether or not you're on Medicare or not, if you're eligible for Medicare, you're getting a lot of ads, right? You're getting the ads, you're getting the phone calls. I shared with a couple folks who were in here earlier, I just heard the statistic that the TV ads, you know, the ads that are on TV all the time. I just heard a couple weeks ago that every hour in the United States, there are 8,000 Medicare TV commercials. Somewhere in the United States, 8,000. And someone said, yeah, they all come to me. Someone who came and said, they're all coming to me. So yeah, it does feel like it, right? Most of those are companies, brokerages, something like that with something to sell, which is fine. Just know that we're not selling anything, okay? We're just here to help you as a consumer. All right, so we'll keep moving. This is just a little bragging page, talks about all the folks we helped last year. We are actually on pace to break all of those records this year. Okay, I think some of them we've already surpassed, okay? And that's not just us in Columbus, that's the folks here in Findlay, Ohio, and our volunteers across the state. But let's dive into this. If you want to follow along in the book, and I recommend it, particularly if you're a note taker. This is going to look a lot like page 4 in the book, where it says, what is Medicare? Hopefully I don't have to start there. Hopefully I have a group that knows that Medicare is federal health insurance, right? 3 groups of people who qualify. 65 and older. That's the majority of folks on Medicare because they have reached age 65 or older. But you can be on Medicare prior to age 65 if you are disabled. Here we're talking Social Security disability or Railroad Retirement Board disability. So for Social Security is going to be the more common one, but generally, if Social Security has deemed that you are disabled after 2 years, 24 months of disability payments, you'll then be enrolled in Medicare A and B regardless of your age. And then any age and diagnosed with end-stage renal disease, which is end-stage kidney failure, or ALS, Lou Gehrig's disease. Folks with those conditions can also sign up for Medicare prior to 65. But the vast majority of folks, something like 85% of the folks on Medicare, because they have reached age 65 or older. Then we have this option 1, option 2, and it's laid out there on page 4, pretty similar to what you see up there on the screen. This is where we're going to spend most of our time, because everybody on Medicare is in one of those 2 categories. You're either over here in this option 1, original Medicare A and B, you may or may not have some sort of a secondary insurance. Hopefully you have some sort of a Medicare Part D prescription drug coverage, or you're over here in this option 2, Medicare Advantage, kind of an all-in-one package. So most of what we're going to talk about this morning are these pieces. What they are, how they work together, a general idea of what they cost, what they cover, and where we're at right now. If you look at the bottom of the page, it says Medicare's open enrollment, October 15th to December 7th. So we're a good ways into it. We got not quite 3 weeks to go. This is the time of year you can make changes to your coverage for next year. We're going to talk a lot about the different pieces, how you can access resources like OSHIIP to help make informed choices here. All right, so applying for Medicare. I got a big group, so I know we're going to have some folks not yet there. Who's not yet on Medicare? Okay, all right, so let's talk about applying. If at age 65 you have already taken your Social Security, that means you took it early, right? Means you took early Social Security. If you took your Social Security prior to age 65, you don't have to do anything to sign up for Medicare A and B. Social Security is going to do it for you. They're going to go ahead and sign you up automatically. What about everybody else? I'm not taking my Social Security early. You can still start your Medicare at 65. Even if you haven't taken Social Security, even if you're still working, you can still start your Medicare at 65. You're going to have to actively apply through Social Security, or it says, or the Railroad Retirement Board, if you happen to be, an employee or a spouse of the railroad. A spouse of a railroad employee, not spouse of a railroad. During this 7-month initial enrollment period, it's there on page 5. You'll see it's the 3 months before the month you turn 65, the month you turn 65, the 3 months after. Got a full 7 months in there to do that. How do I do it? It's through Social Security. Strongly, strongly, strongly recommend, if you're comfortable doing it online, to do it online. www.ssa.gov. SSA just means Social Security Administration. .gov meaning you're on a government website. You can still call and schedule an appointment. And this number, this 800-772-1213, that is Social Security's national number. 8 a.m. to 7 p.m., you can call and schedule an appointment. If you're just signing up for Medicare for the first time, generally right now what they're going to do is set up a telephone appointment. You call and they say, hey, we're going to do this, we're going to talk at 2 p.m. on December 8th, whatever it is, and they can do it that way over the phone. Just signing up for Medicare, it's a pretty easy process. Doing it over the phone's fine. If you're comfortable doing it online, I recommend doing it online. What I don't recommend doing is getting in the car and driving over to Social Security. Okay? They were, before the shutdown, they were as backed up as they've ever been in the history of Social Security. I could only imagine what it's like right now. All right? So I don't recommend getting in the car, driving over, unless you've made an appointment. Okay? You can go and drop off material. If they say, hey, we need this document, you can go do that and drop off. But if you're going over hoping to sit down and talk to someone, you might end up sitting there all day and may or may not get to talk to somebody. So I would recommend if it's something you want to do in person or you feel like you need to do in person, definitely make an appointment. Definitely make an appointment to do that.
Question. Like, I have Part A, but I don't have B because I'm on my husband's insurance. Now they said when he's ready to retire and he has to take it. They said all I have to do is get a paper from where he works.
Yep, hold that thought. Yep, hold that thought. I'm gonna get there. Yes.
Okay, and I just wondered if that would be something I could still do online.
Yes, absolutely you can.
Okay.
Yep. Whoops. Oh, I thought there was more slides there. They must have changed my PowerPoint on me. One of the main questions I get is, hey, I'm turning 65. Do I have to sign up for Medicare? I heard there were these late enrollment penalties. Do I got it? I see a lot of heads nodding. Do I have to sign up when I turn 65? And this is where I sound like a true government employee. It depends. It depends. The general rule is, yeah. And by the way, kind of what I'm going through is what it says down here at the bottom of page 5 where it says things to remember when turning 65, but I'm going to say it a different way. The general rule is, yeah, when you turn 65, you should sign up for Medicare A and B. However, there's an exception to the rule. And the exception to that rule is if you are covered under a current employer's group health plan through yourself or your spouse. So let me back that up. Current employer. Either I'm still working if it's my insurance, or my wife is still working and I'm covered by my wife. Has to be a current employee. Cannot be a retirement plan or something like that. I have to still be working, or if my wife's insurance is covering me, my wife has to still be working, right? Has to be a group health plan offered by the employer. So if you're someone, for example, maybe you have a private insurance plan, maybe you're self-employed, or you work for a company that doesn't offer insurance and you have to buy your own plan, in that case, it's not going to count. You would have to sign up for Medicare A and B. But if you have that group health insurance through a current employer, you can delay signing up for Medicare. When that changes, you can go back and sign up and you won't be subject to any sort of penalties. How do I go about signing up? I'm going to keep working. Maybe you're going to keep working until you're 66 or 67, or there's a lady up in Toledo who's 101 and still works for the school district up there. Still working. Met her last summer, and I said, we're never going to talk about Medicare, are we? And she said, nope, because she's going to work forever, right? She's 101 now, so for crying out loud, she's going to work forever. I don't recommend working until you're in your 80s or 90s, though, but hey, works for her. What do? I always say about 3 months before you're ready to retire. Hopefully or if it's your spouse, 3 months before your spouse is ready to retire, is the time to start working on it. Start getting your ducks in a row, figure out when I want to enroll in A and B and what else I want. To answer the questions that she had earlier, you do generally have to provide Social Security with a form. It's a CMS form that just shows that, hey, I had employer coverage from this date to this date to show that I had that coverage. It is something that, yes, you can upload and do online if you want to do it that way. Okay, we'll keep going. Pages 6 and 7 in the book talk about original Medicare, Medicare A and B. This is original Medicare, is the only part of Medicare that is coming directly from the federal government. Everything else we're going to talk about has some sort of private component to it, some sort of private insurance. A and B is straight from the government. Red, white, and blue card, right? Medicare Part A, Part B. The card will say, if you can read it that far away, it says hospital and in parentheses Part A, medical in parentheses Part B. I always say think about your hospital as your inpatient care. Inpatient. So inpatient in the hospital. Inpatient in a skilled nursing facility. So a skilled nursing facility is like short-term nursing that sometimes follows the hospital, right? You're in the hospital's going to dismiss you. They're not able to send you home yet. They're going to send you to a rehab for weeks or months until they're able to send you home. Home health care, now for Medicare, we are talking skilled, part-time skilled home health care. So things like part-time nursing, physical therapy, speech language therapy, something along those lines, and hospice care. Hospice is still defined as end-of-life care, care for folks who are terminally ill. It's kind of changed a little bit over the last decade or so, right? There's a lot of folks who go into hospice and are in there for years and years sometimes. Sometimes folks come out of hospice, right? But it's still defined as end-of-life care. All covered under Part A. Jumping over to page 7, Part B. If you think about Part A, your hospital is inpatient care. Think about Part B, your medical as outpatient care. So outpatient stuff. First thing up there, outpatient, it says outpatient services. The book says outpatient hospital and medical services. It's a better definition for it. So anything you're doing as an outpatient at the hospital, which is a lot. A lot of stuff these days are outpatient at the hospital, right? You have everything from the emergency room to outpatient procedures, surgeries, tests, appointments, whatever it is. You're doing it over at the hospital, but you're an outpatient. Your doctors and providers are covered under Part B, so this is your doctor's appointments. It's also going to cover like nurse practitioners and physician's assistants and physical therapists, psychologists, all that good stuff. Not just the doctors, but our providers. Preventative benefits, we're going to talk about a little bit more on the next slide. And durable medical equipment. So durable medical equipment are things like oxygen and oxygen supplies, walkers, wheelchairs, your diabetic testing supplies, CPAP machines, actual physical equipment that we sometimes need to keep us going at our best. All right. Oh, I'm sorry. I told you this was a new PowerPoint. This was updated as of yesterday, so it's going to throw me a couple of times. Real quick, this just kind of goes through some of the differences between original Medicare, Medicare Advantage, which we're going to get into in a little bit more detail. We are going to end up on page 8 here in a moment, so bear with me, those of you following along in the book. So original Medicare, A and B, we might need a Part D. As I say, you see any provider, you don't need a referral. There's deductibles, there's co-insurance. Does not include some services, but includes just about everything. And you may have some additional. Later in the talk, we're going to get into the Advantage, which usually covers A and B. Usually has the Part D. You may be some restriction. Might need to see a specialist. The costs are going to change, and some things are going to be a little different. So bear with me. Now we're going to get into the Medicare costs. I thought we had preventative in there. Oh well. As I said, brand new PowerPoint. Page 9. Now, your book is going to say 2025 amounts because they announced 2026 amounts yesterday morning. Yesterday morning. I was in the car driving and my phone just kept going off, and I said, well, they must have announced 2026 numbers and everybody's texting me to ask me questions or tell me about it, right? And that's what it was. So, again, page 25 is out of date as of yesterday. They finally announced next year's numbers. Premiums for A and B. We're still talking original. So Part A, most folks do not pay a premium for their Medicare Part A. How did you earn that? How did you get a premium-free Part A? Either you worked at least 10 years in your lifetime and had Medicare taxes taken out of your paycheck, or you had a spouse who worked at least 10 years in their lifetime and had Medicare taxes taken out of their paycheck. That is better than 99% of us, all right? So most folks have earned their Part A premium free. You will read things that say Part A is free. That's a pet peeve of mine. It's not free. You earned it. You paid for it. It's not free, right? Part B, however, does have a monthly premium. Most folks who are on both Social Security and Medicare have that Part B taken straight out of their Social Security. They have that premium taken straight out of Social Security. So you might talk to folks, particularly you know folks, if you have older friends and relatives who have been on Medicare for a while, they might say, I don't think I pay that. They do, they just don't see it. They don't see it coming out, okay? If they don't pay attention, they don't see it coming out. But this year, Part B premium, I shouldn't say this year, next year, 2026, Part B premium, $202.90. That was a big jump. Went from $185 to $202.90 a month. As I said, folks who get Social Security have it directly taken out of Social Security. If you're not doing that, there's a couple different ways to go about paying it. Then we get into some deductibles. Part A, keep in mind for the Part A deductible, we're talking about inpatient in the hospital. For inpatient in the hospital, you see there that $1,736 when you're admitted as an inpatient. That's going to cover you up to 60 days in the hospital. If you're there longer than 60 days, now I'm talking in the hospital, not the skilled nursing, the actual hospital, you'll see a daily copay for day 61 through 90, $434 a day, which doubles on day 91 to $868. Most folks are not in the hospital anywhere near 60 days, right? I mean, it happens, but it's pretty darn rare. Generally, you're in the hospital for a few days. If they're not able to dismiss you from the hospital, that's where the skilled nursing is going to come in. And they show the skilled nursing for days, no copay for days 1 through 20. And then starting on day 21 through 100, a daily copay of $217 a day. There's Part A. Let's jump back up to Part B. Part B does have an annual deductible, $283. This is member outpatient stuff. So outpatient at the hospital, doctor's appointments, things like that. The first $283 you would pay. Once you have met that once in the year, your Part B is an 80-20. Where Medicare is paying 80%, you're left over with that remaining 20%. You're left with that remaining 20%. And I'm sorry that if I went fast on that. When we wrap it all up, if you want me to go through those numbers again, I'm happy to do it. If you wanted to write all that down. That's what's going to take the most time this morning, talking about original Medicare Part A. All right. For some folks, that's it. I just have original Medicare. If I get sick or I get injured, hopefully I can pay what Medicare does not. Other folks say, nope, I want something to pay what Medicare does not. I want something to fill in that difference. Couple different ways to do it with this secondary coverage. We are going to end up on page, let me get there, 12 here in a moment. Those of you following the book, we're going to end up on page 12. So original Medicare A and B, secondary coverage. Comes in a few different forms. Group health insurance, that's if you're fortunate enough that you worked for a company or a union that continued to offer you health insurance after you've retired, or if it's a spouse, after your spouse retired. We don't see as many of those as we used to. I've been doing this for about 15 years. There were a lot more of these 15 years ago than there are today, unfortunately. There are still some out there though, right? Some of our state teachers and school employees, some of those folks still have those, but we don't see them like we used to. Medicaid, we're going to touch on here at some point. Medicaid is for folks with limited incomes, limited resources. There are a lot of folks who have both. They have Medicare as a primary insurance, Medicaid as a secondary insurance. And last but not least, we're going to talk about the Medicare supplement. What is going on? Because it jumped me all the way to Part D. I feel like I missed a whole big section, but that's okay. We're going to make it up. Okay. We're going to do it slightly differently then. We're going to talk about Medicare supplement without using the slides. Only one slide for it anyway. So let's talk about Medicare supplements that start on page 13 there. Start on page 12. These are private insurance policies sold by private companies. Private insurance policies sold by private companies. If you purchase a Medicare supplement, you are paying them a premium every month. In exchange for your premium, they come in after Medicare pays its portion, picks up most, if not everything, Medicare did not. They're sometimes called a Medicare supplement. Some companies will call them a Medigap. Medicare supplement, Medigap is two terms for the exact same thing. So you kind of got to drill it in that Medicare supplement, Medigap is the same thing. As I said, private insurance companies private policies sold by private companies. They are not inexpensive. They are not inexpensive. Even those of you who are not yet on Medicare, let's say you're 65, right? You're signing up for Medicare at 65 for the first time. I would not expect to get a Medicare supplement for less than $100 a month. And that's on top of the $202.90 we're already paying. You see where we're adding up pretty quick here? Why do people like them? They're so darn expensive. Why do people want them? A couple big things. Number one, there's no network with these plans. I can go to any doctor, any hospital that accepts Medicare, and I don't have to worry about, is this doctor in my network? Is this facility in my network? As long as they accept Medicare, I'm good to go. I can go there. So if you're ever concerned about, you know, I want to be able to go to Cleveland Clinic, or I want to be able to go to OSU, or if my doctor says, hey, I want you to go to this specialist and they're the best in the business, I don't have to check back with my plan to see if they're in my network. I can just sign up and go. That's one reason people like them. The other reason people like them is they do generally pick up everything Medicare did not. So even if you did have some major medical expenses, even if you were in the hospital, you know, in the hospital for something major, and then you went to skilled nursing after that, generally the supplement's going to pick up everything Medicare didn't. So you're going to come home and you're not going to get a bill. You're paying more every month in premium, but you're not paying on the back end. I had a lady, that's been almost a month ago now, who was telling me the story. She was in her 70s, but her husband, I think, was in his 90s. He was quite a bit older than her. And she said, every year we were thinking about getting rid of this supplement. We're paying out so much money every month. And she goes, and in the last year, he's had over $400,000 in medical bills. And she goes, and we didn't pay a dime. And I said, well, yeah, that's because you had your original and you had your supplement. Your supplement picked up what original did not. But they're not cheap. They don't start out cheap, and then guess what? Every year, you get a year older, right? Guess what else happens every year? They go up, right? Yeah, they're going to go up a little bit every year. And it will be more expensive if you wait until you're 66, 67 to sign up for one of these plans. The very bottom of page 12 talks about when your right to buy a policy is guaranteed. Everyone who threw their hand up when I said who's not yet on Medicare, the first bullet point is referencing you. The first 6 months that you have started your Medicare Part B at age 65 or older, you're in a guaranteed issue. You can sign up for any Medicare supplement plan offered in the state of Ohio. They have to accept you as a client, sell you a plan, and they can't take your health into account for 6 months. Now, let's be real clear. Two things have to be true. At least 65 years old and you started your Part B. Why do I say at least 65? Maybe you're going to wait. Maybe you're going to keep working, or you have a spouse that's going to keep working, and you're not going to sign up to your 66 or 67, hopefully not 101 like that lady up in Toledo, but 66, 67. You can, it's whenever you start your Part B, you have those 6 months. You can sign up, no questions asked. The only other time that's going to come up are this second bullet point where it says special circumstances. It's generally 63 days after you've lost coverage through no fault of your own. That can be a lot of things. That can be your plan went out of business. Your plan left Ohio. Your plan left Northwest Ohio. Maybe you moved. You know, maybe you got tired of this cold weather and said, hey, I'm going to go down where it's warm all year, right? Generally, you have a nice little window. It's 63 days. It's a little better than 2 months, where once again, you can enroll in one of these plans. They have to accept you, and they cannot take your health into account. What if you're not in one of these guaranteed issue periods? Can I still change it? You can absolutely still apply for a new supplement plan. You can apply at any time. However, if I'm not in a guaranteed issue period, they're going to give me a health questionnaire. At the very least, they're going to give me a questionnaire to fill out, and they're going to want to know, list all the surgeries I've had. Have I ever had cancer, heart disease, stroke, right? And because they are private companies, they have the right to say, no thanks, we don't want to sell you a plan. You know, I always tell folks the way to think about it is the company, the insurance company, what they're looking at it on their end of the deal here, they want to know, are you more likely to make them money or lose them money? That's what they want to know, right? That's all insurance, right? All insurance wants us to pay our premiums and not have a bunch of claims, right? Same deal. They want us to pay our premiums and not have a bunch of claims. So I don't discourage anyone from applying for a new plan. Whether you're brand new to Medicare or maybe never had one before, or you've had one, you just want to see if there's a better deal, it's absolutely worth looking at what's out there. It's absolutely worth applying for other plans. Worst thing that's going to happen is they're going to tell you no, right? Keep in mind they're in the business of insuring people 65 and older. You're not competing with 25-year-olds and like that sort of thing like we do with other insurance. Not that it's competition, but I mean that they're not in that pool. So things like high blood pressure, high cholesterol, diabetes that's controlled with medication, that's not going to disqualify you. They're looking more at things like cancer, heart disease, strokes, kidney, liver disease, things like that, right? I had someone in this building, actually, it's been a couple years ago, came in and he had been on a different type of coverage and really wanted to get this supplement because he'd just been diagnosed with lung cancer and was getting ready to start his chemotherapy. And I said, well, I got some bad news for you. I don't think you're going to be able to sign up for one of these plans. I don't think anybody, because nobody wants to buy someone start covering someone who they know is about ready to have a bunch of expenses, right? So how do I go through these? This is one of the places we can help you out with, okay? If you go all the way to page 15 and 16, you'll see a whole list of companies out there, right? That is about 30% of what's available in Ohio. All right, that's about 30% of what's available in Ohio, meaning the companies out there. There's a ton of companies that sell these plans, over 100 easily. We can help narrow it down for you. We have some tools that you don't have access to. We can give you, hey, give me 5 different plans or 10 different plans to help narrow that down. You can also go through an agent to do this. We're never going to recommend a specific agent because we're not able to do that. But this is one of the places where a lot of folks do prefer to go through an agent in their community just to see what's out there and do a better, get kind of cut through the noise that way. Keep in mind, you can always call us, even if you do see an agent, even if you're working with an agent and you just want to double check stuff, get in touch with us. We'd be glad to go through that with you. All right. I don't know where that whole section went, but that's okay. We're going to go all the way to page 17. Talked about original, talked about secondary. The third piece of this option 1, if I'm going option, whether or not I have any sort of secondary insurance. If I have original Medicare A and B, the other piece I need is what starts there on page 17, Medicare Part D. Medicare's prescription drug coverage, right? Part D. So it is offered in 2 different ways. What we're going to talk about first are these standalone Part D plans. And where it says PDP, that's all it means, prescription drug plan. That's what goes with original Medicare. Here in a couple minutes, we're going to get into the Medicare Advantage plans. They also have prescription drug coverage as part of the Medicare Advantage plans. The initial enrollment is the same for signing up for Medicare, and everybody with Medicare can sign up for any Part D plan offered in the state of Ohio. You can sign up for any plan offered in Ohio, and you can change it every year. That's the first part of this Medicare open enrollment that we're in right now, October 15th to December 7th. Now, just to be clear, you folks who are new to Medicare or not yet signed up for Medicare, you're not limited to this open enrollment your first year. Your first year, you're in your initial enrollment. That's 7 months, 3 months before the month of, the 3 months after, right? But then every year thereafter, you are part of the open enrollment, October 15th to December 7th. It's a time of year you can look at your drug plan, see if it's still going to be the best one for next year. If it's not, you can change and go to another plan. This doesn't make me popular, but I always say I recommend everybody on Medicare Part D review their drug plan every fall, every single year. Why? Because they change. What they charge in premiums change, what they charge in copays change. Even the drugs they cover, even the medicine they cover could change from year to year. And unless you take a look at it every fall, you could end up with a surprise in January. So this is what we do this time of year more than anything else, is just help folks with their Advantage plans and their Part D plans. So again, you can give us a call, that 800-686-1578, or make an appointment here with the folks here at 50 North. We're going to do it the same way, regardless of how you do it. We're going to say, hey, bring us a list of your prescriptions. Here's what I take, here's my dosage, here's how often I take them, and have your Medicare card ready to go. If you don't change your plan, we don't need the Medicare card. But what we do is we take those prescriptions, we put it into Medicare.gov, which by the way is available to you as well, Medicare.gov. A lot of folks will use it and it's not great user friendly, but by all means, if you want to give it a shot, go for it. Put it into Medicare.gov. It will take, next year there are 10 plans to choose from. It will take those 10 plans and it will rank them 1 to 10 based on the medicine you take. Here's the least expensive, most cost-effective plan based on what you take, number 2, number 3. It's pretty straightforward, you know? And I always tell folks, in my opinion, go for the best deal. If for whatever reason you don't like it, change it next year. Because all we're talking about with Part D are the prescriptions that you can pick up at the pharmacy and give to yourself. Has nothing to do with your doctors, has nothing to do with prescribers or anything like that. It's just what you pick up at the pharmacy and give yourself. And page, I think it's 19 has next year. Yeah, 19 again, out of date. The Part D costs are a little bit out of date. These are the 2026. So I said there are 10 available. There's a 0 premium plan. There's a couple premiums in the $7 range, right? A couple different plans in the $7 range. There's a couple in the $20 range, and then it goes much higher from there, all right? All the way up to one that's $123.40. Annual deductible, there's a percentage you pay. This is where I'm gonna try to scare you into comparing your Part D plan. Those of you already on Medicare, if you have Part D. There is one plan that 2 years ago, and I can say what it is, it's SilverScript, Aetna SilverScript. 2 years ago, 2024, that plan was $5.40 a month was the premium. This year, 2025, it's $40.30 a month. Went up $35. Next year, 2026, it is $90 a month. In 2 years, that went up $85 a month for what is effectively the same plan. What we get are calls in January when they get their bill, their premium bill. Hey, what the heck happened with my Part D? I got this huge bill. And we'll say, well, that's what it is for next year. Oh, that's terrible. What can I do about it? You missed it. Right now is when you got to do something about it, October 15th to December 7th. That's an extreme example, but that's one of the reasons, you know, I say to look at it every single year. Annual deductible can go as high as $615. Another reason it's good to talk to somebody, because a lot of times, a lot of these plans won't even charge that deductible, particularly on generic drugs and things like that. So I have people say, hey, it shows I have this big deductible, but I've never paid anything on it. Nope, because of what you take. And then once you hit that deductible, or however your plan does it, generally you're gonna have a flat amount. The most you're gonna pay is 25%. That's gonna be your more expensive stuff, right? Your name brand stuff. Generally it's a flat amount, and sometimes it's zero. Sometimes it's zero. This year, there's a maximum out of pocket you can pay in co-pays for your prescriptions of $2,000. That's only going up by $100 for next year. So next year, the most you're going to be able to pay is $2,100. But all these plans are a little bit different. It's important to take a look at it. The other thing I will say is if I have a Part D plan, whether it is a standalone Part D plan or part of a Medicare Advantage, all adult vaccines are covered at 100%. All right, so if there's any vaccinations you need, obviously things like flu shots and the pneumonia shot and stuff, that's big right now, right? COVID-19 shot, that's all the big stuff right now. But even things like shingles, RSV, things like that, that is all covered 100% under these plans now. And that's only been the last couple of years we've had that. So that's a good thing. Gets us through option 1. A lot of folks go this route. A lot of folks go with this option 2, Medicare Advantage. Starts there on page 22. These are all-in-one packages. That's why there's only one square there, right? I've said before, you can almost think of it like the cards in your wallet, right? If I'm going option 1, I got 3 cards. If I got option 2, I've only got my Medicare Advantage card. It is an all-in-one package. Hospital, medical, prescriptions, all wrapped up in one plan. Essentially what you're doing is when you sign up for a Medicare Advantage plan, it is a private company under contract with Medicare. While you have that Medicare Advantage plan, you're saying that is now my insurance. Not using my original Medicare, still got it, still paying for it, but while I have this Medicare Advantage plan, this is my insurance. What it costs, what it covers, the providers who accept it, that's what I'm going to go with for as long as I have that plan. I should mention they're sometimes called Part C. All right, that almost died out completely, and a couple of years ago they started saying it again in the ads just to keep everybody confused, right? Medicare Advantage, Medicare Part C, the same darn thing. Again, to sign up for them, this starts there on page 22. You have to have both parts of Medicare A and B because it's going to stand in for your Medicare. The plans you can sign up for are based on the county you live in. Does not mean that your doctors, hospitals, providers are limited to Hancock County. It means that if you are a resident of Hancock County, you can only sign up for the plans offered in Hancock County. If you lived in Wood County, you could only sign up for the plans offered in Wood County. If you ever see those ads on TV where they say, I called and they looked up my zip code, and you're like, why did I need to know my zip code? That's why. They want to know what Medicare Advantage plan they can sign you up for, right? I think Hancock County, I believe, has 62 to choose from this year. When I started this job 15 years ago, Hancock County had 4. I think they have 62 for next year. So it's exploded. There's a lot of plans out there. There are no age or medical restrictions. You can sign up for any Medicare Advantage plan offered in your county, and you can change it every single year. As they say, an alternative to original Medicare, what I say is it's going to stand in. It's going to stand in for your Medicare, and about, not quite halfway down page 22, they talk about the Health Maintenance Organization, the HMO, and the Preferred Provider Organization, the PPO. This is what the vast majority of these plans in Ohio are. They're either an HMO or a PPO. The HMO, and by the way, if you have a Medicare Advantage card, it'll say right on it. Usually right there in the upper right-hand corner. It'll say HMO or PPO right on the card itself, in case you're curious. HMO, Health Maintenance Organization. That means you have a network of doctors, hospitals, providers that you are required to stick with. Got to stick with the in-network if I'm going with the HMO. The PPO, the Preferred Provider Network. With the PPO, you still have a network of doctors, hospitals, providers. It's going to cost you less money if you always stick with the providers in your network. But with the PPO, you can go outside of your network, see any provider who accepts that plan, but you'll pay a higher copay. You'll pay more out of pocket if they're out of your network. So the HMO, you're kind of locked into your network. PPO, you can go in and out of your network, but it's going to cost you less if you always go outside of your network. All right. Some of the costs. Now, the thing is, every one of these plans is going to have a different cost and different coverage. They're all different. Think of them as 60 different insurances, right? 60 different insurances to pick from. Monthly premium, there's a lot of them out there that are still zero premium. And a lot of the ads you're seeing, they talk about the zero premium plan, right? Zero premium plan. What does that mean? It means they're just insuring you for free, right? They just like you and they say, you know, you seem like nice people up here. We're going to give you free insurance, right? Of course not. How does that work? You are still paying your Part B premium to Medicare. That $202.90, what it's going to be next year, right? $202.90, you're paying that to Medicare. If you're enrolled in a Medicare Advantage plan, Medicare takes most of that money and sends it on to them. All right, so even if they say they're a zero premium, they're still getting paid, and they're still getting paid by you. You know nothing's free, right? Nothing's free, you're paying for it. Medicare is just working as the middleman in that situation. There are some with premiums. I haven't seen anything in Hancock County anywhere near $219. For some reason, those are all like Southwest Cincinnati area. They have some really expensive Advantage plans. I don't know why, but they do. Most are premium free. There are some with some premiums on top of them though. Deductibles, some have them, some don't. Maximum out of pocket. They all have a maximum out of pocket amount though. The way these plans are going to work a little differently than original Medicare is whenever you use it, you're going to have a copay. You'll have a certain copay at your primary care doctor, your family doctor. You'll have a higher copay at a specialist. Specialist is anybody who's not your primary doctor, right? You'll have a copay the first few days in the hospital. You'll have a copay in the skilled nursing. There is an out-of-pocket maximum, and again, it depends on the plan. They can be as low as $2,800 for the year, and this year as much as $13,900. I haven't seen that one, but that's a lot. Meaning, even if I have one of these Advantage plans, and this is, worst case scenario, I have some major medical expenses this year, there is a maximum amount you're going to pay. Once you've hit that amount, you're not paying any more for the year, but of course it'll start over come January 1, right? It'll start January 1. Thing to keep in mind is they are all different. Every one of these plans offers different prices. They have different doctors, hospitals who are in their network or out of their network, right? And they change every year. Some require prior authorization, some don't. But the most important thing is we always say, you need to make sure your doctors are in network for that plan. That's the main first question to ask. I don't care what else they're offering. They're offering all sorts of extra benefits, but if my doctor doesn't take it, it doesn't do me a whole heck of a lot of good. You know, we got to look at, you know, the core benefits of the plan. Initial enrollment, again, for you folks who are new, same 7 months. If you want to sign up for Medicare Advantage straight out of the gate, now's the time, or whenever you sign up for Medicare is the time to do it. But it has that same open enrollment. And this is, well, still there 22, I guess. October 15th to December 7. Just like with the Part D, you can compare your plan for next year. Make sure it's still going to be a good one, or is there something better out there? You can make changes. All this stuff goes into effect come January. There's a little bit of a do-over period with the Medicare Advantage plan, however. First 3 months of the year. They call it the very confusing Medicare Advantage open enrollment period. I call it the do-over period. Come January, if you are on a Medicare Advantage plan, whether it's brand new, I signed up for it during open enrollment, or I've had it for a while. You know, I've had it for a couple years and you don't want it anymore. The number one reason why someone would make that decision come January is they find out their doctor's out of network or Blanchard Hospital's out of network or whatever, right? And say, hey, this plan's not going to work for them anymore. You have the first 3 months of the year where you can still change it. You can switch to any other Medicare Advantage plan offered in your county, or you can go back to original Medicare and drop Advantage altogether. Any changes will take effect the first of the next month. So if I did it in January, it would go into effect February 1st, and so on and so forth. That's just a little bit of a little extra security there in case something falls through like that. Bunch of different open enrollment decisions. You can change your D plan. You can enroll in a Part D for the first time. You can switch from Advantage, or you can change that stuff. You don't have to make any changes, and if you don't make any changes, whatever you have right now will roll over into next year. All right, so if you're happy with what you got and you don't need to make any changes, then you don't have to call anybody and tell them you're doing the same thing. It'll automatically roll over. Some of the different dates, we're past most of these, right? Going all the way down here. Open enrollment started October 15th. It's going to end December 7th. Just to be real clear, OSHIIP, the Department of Insurance, and 50 North, effectively we're done December 5th because the 6th and the 7th are Saturday, Sunday. I don't want anyone calling over here on December 7th and saying, hey, they're not answering the phone. Nope, it's Sunday. They're not there. 800 Medicare will be available, but get it done before then. Please don't call 800 Medicare on December 7th. You're in for a very bad Sunday if you do that. So I almost want people to get in their head December 5th this year because just the way the calendar lays itself out. You can call me on Sunday the 7th, but I promise you I'm not going to respond. I promise I'm not going to respond. Then come January, that's when any changes you make will go into effect for next year. They mentioned real quick the Medicare savings programs. Don't go all the way back. This is all the way back on page 10 or 11. Talk about some folks with limited income, limited resources. These are some plans you sign up for, and they will reimburse that Part B premium. If you need more information about that, give us a call. Our folks, we can ask you some questions, find out if it's something you qualify for, and help you actually enroll in that. Again, 800-686-1578. Same way with the low income subsidy. This is a program with the Part D to help save some costs there as well. Real quick, what the heck are they selling? All those ads, those 8,000 ads per hour. They advertise everything under the sun, right? Hey, we have extra benefits that Medicare may not offer you. Did you know we have extra benefits? And they talk about things like grocery cards and fitness memberships and, of course, vision, dental, hearing, things like that, right? What's the deal? Is that stuff real? Yeah, it actually is. It has to be. If they advertise it, they have to offer it. Does that mean everybody gets it? Not necessarily. Does that mean it's automatic? Not usually. But more importantly, that's not how you pick your health insurance. Vision, dental, hearing, sure, I'm cool with that. Grocery cards are not how you pick your health insurance, all right? I always tell folks, before you get all this extra stuff up there, fitness memberships and things like that, hey, that sounds good. I can get a free fitness membership and I can go to the Y and work out for free. Great, but you first got to make sure, does my doctor accept this plan? What's that going to cost me when I see my doctor? Does the hospital accept it? What's that going to cost me if I end up in the hospital? Are all my prescriptions covered? What's that going to cost me? All those kind of have to be answered before you think about this other stuff. The other thing I'll say about it is all these 800 numbers. What do they want you to do? Call now. We got operators standing by, right? Just to be clear, particularly since I'm being filmed today, I am not telling you not to call those numbers because I'm not allowed to do that. I'm not allowed to tell you not to call those numbers. I can tell you who you're calling though. Do you think those numbers are answered in Ohio? Do you think they're answered in the United States? No. Most of them are the Philippines, some are still India. They're actually not insurance companies. They are customer service reps who when you call that number, that screen's what's going to pop up. And they're going to say, oh, okay, this is an insurance call. They have their questions to go through with you, right? And if they get you on the hook, then they'll transfer you to an insurance broker, right? But even if they don't, even if they go through these questions and you're like, you know what, never mind, forget it. This doesn't sound like what I thought it was going to be, I'm going to hang up. They still make money off of you. How? Because their job is to attach phone numbers to human beings. And they can say, hey, Bob just called me at this phone number. This is a live phone number, and there's a person who answers this phone. And then they sell that to other telemarketing firms. They sell that number to other telemarketing firms. And then what happens? You get even more calls. So again, just to be 100% clear, I am not telling you not to call those 800 numbers. If you're someone who says, I don't get enough phone calls while I'm trying to eat dinner at night, this is the way to get that call volume up, all right? If you really want someone to talk, if you really want to make some new friends in India, and that is a great way to do it. But that's generally what it's going to be. Generally, it's going to be that sort of thing. My point is, there are resources right in your community to help you. You don't have to go to the Philippines to talk to someone to get that sort of coverage, all right? You can talk to someone right in your own community, and you can always give us a call at 800-686-1578. Bottom of page, all the way at the back, almost at the back, page 25, talks about fraud. I'm not going to spend too much time on fraud this morning. I do want to talk about this last one here. Folks representing themselves as Medicare. Medicare has never called you. No one from Medicare has called you on the telephone. No one from Social Security has ever called you on the telephone, all right? But if you're someone who answers the phone, particularly if it's a caller ID and you don't know the number and you go ahead and pick it up anyway, you're probably going to talk to someone who claims to be from Medicare at some point, okay? They're lying to you, okay? They're scammers, they're crooks. You know this already, right? They're criminals. What are they after? They're after your information. They're going to say something to you like, hey, you probably heard we're sending everybody a new Medicare card. And they always started out with you probably heard. And the reason they say that is because they want to make you feel like you're stupid if you haven't heard that. They're lying to you. You're not getting a new Medicare card, but they say that. And then they say, we're ready to mail yours out, but we just got to verify your information first. Or we had a data breach, and we got to verify your info. So we just need your legal name and your date of birth and your Medicare number, or maybe your Social Security number, whichever one they think they might get from you, right? What are they doing there? They're stealing your identity. Your Medicare number, those of you on Medicare, your Medicare number is worth about 20 to 30 grand on the black market to the criminals. All right? So you're going to protect that the same way you'd protect your Social Security number. Don't give that out to anyone who calls you on the phone. If you call us, if you make an appointment and come in and talk to the counselors here, yeah, they're going to need some info, you know? If you call Medicare or Social Security or go in there, they're going to need some info, right? Your doctors and the hospitals, of course, they need all that information, right? But we're not going to call out to you and ask for it. Don't give it away. Don't give it away to folks that way, okay? And you're all nodding saying, you know what, Dave, we know this. We got it. I hear you. I do. It's easy to get caught off guard. And this homework assignment, I want you to remind everybody. If you have family members, friends, neighbors, Medicare age, take a second and remind them, hey, remember, don't give your information out over the phone. If you made the call, fine. If you called, someone, great, but don't give it out to anyone who calls you. Bottom of this talks about Pro Seniors. They are another federal agency. They actually help folks who have become victims of fraud, waste, and abuse. They kind of help folks put the mess back together a little bit. And you see their number there, that 800-293-4767. You can actually even set up a time to speak to an attorney if you're 60 or older. Speak to an attorney for free as well. But I always say don't put yourself in the position where you need them, right? Don't put yourself in the position where you need their help. The checklist, just know what your coverage is. The ANOC is your annual notice of change. That's for those of you already on Medicare. You would have got something talking about your annual notice of change. Review your plan options, know the dates. And again, you can always call us. 800-686-1578, Monday through Friday, 7:30 to 5. Certified counselors right here. Of course, he's doing Bowling Green Public TV. If you're in Wood County Committee on Aging, we got folks there that are doing appointments as well, both who have been doing it for a very long time. Very back cover of the book is just phone numbers, websites, right? We're at the top because it's my book. 800-686-1578, 7:30 to 5. Medicare's on there. They are 24 hours a day, 7 days a week, but for the most part, they're going to send you back to us anyway. They'll answer general questions, but if it's specific stuff, they're going to say, well, we're going to have you call your state SHIP program. That's us. Social Security, they are 8 a.m. to 7 p.m. But as you go through there, you'll see veterans are up there. Some of the different retiree systems. That's there, so if you're looking for that number or that website, I hope you remember, hey, I think I got that. I think Dave gave that to me. If you can't find the book and you are looking, let's say you're a veteran and you're like, hey, I want to see if I qualify for anything for the Veterans Administration. You can't find that book and you're like, gosh darn, I want to make sure I got the right number. Again, you could call over to 50 North and just say, hey, I'm looking for the number for the VA. They'd be happy to find that and make sure you're going to the right place as well. But that's what I got for you guys. What questions do you folks have? Or is everyone going to be shy because you're on film? Yes, sir. 2 questions. Yes, sir. You mentioned on the supplements. Yeah. What roughly was it a month for most of the supplements? Well, his question was, when it comes to the Medicare Supplement Medigap plan, I said if you were starting out brand new at 65, somewhere around $100, could be more than that. All right, and then every year it's going to go up from there. Unfortunately, you're going to be more expensive than your wife. We're cheaper when we're young because when they're at childbearing age, their insurance is more expensive and we're cheaper. And then when we get older, it flips. We're more expensive and they're cheaper. I don't know why, because we die earlier. We should be cheaper, right? We don't live as long. We should be less, but no, we cost more. But yes, starting somewhere around 100, 120, 130, and it'll go up every darn year. And then also on the supplements, if you relocate to a different state, the supplement may not go with you, correct? Correct. That's a really good question. So, and let me actually get back to the option 1, option 2 while I'm doing these somewhere. There we go. So, original Medicare, A and B, that is federal, right? Medicare is federal. If I move to a new state, nothing changes there. I have to let Medicare and Social Security know I moved, but otherwise nothing changes. Everything else, the concepts stay the same, meaning you can still get a Medicare supplement, you can still get a Part D, or you can still get a Medicare Advantage. But if I permanently move to another state, when I get there, I'm in an open special enrollment period, again, 63 days, where I do have to sign up for new plans. Exactly. It could be the exact same thing, particularly if I'm with a national company. So let's say I have AARP, and I'm not picking on AARP, they're top of the alphabet, right? I have United Healthcare through AARP, and I move to Indiana. I could probably find the exact same plan, but I'm not going to be on the Ohio AARP plan anymore. I got to switch to the Indiana AARP plan. Yes, ma'am.
What's considered a permanent relocation for,
Sure.
snowbirds?
So what's considered a permanent move, What if I spend part of the year down south and part of the year up here, right? Okay, the technical legal definition is wherever you spend 6 months and 1 day. However, no one's tracking you. All right? No one's tracking you. Despite what you might see on internet conspiracy sites, nobody's tracking you. We're not that important. It's wherever you tell them you live. I do know folks who are in Florida 8, 9 months out of the year who still call Ohio their permanent residence, you know? But legally speaking, it's where you spend 6 months and 1 day. But it's not like they left. What's your first name?
Sherry.
It's not like they say, oh, Sherry packed up the car, she's heading south. Mark that date. And then when you come back, you know, no one's tracking us, you know. But I can tell you the legal definition. Or maybe they are, I don't know. You know? Maybe the FBI is keeping an eye on Sherry. We don't know Sherry, it could be, right? Anything else, guys? Yes, sir. Hey, I know you.
Hey, my wife, she's already getting Social Security now. Her birthday's in September. Now,
Sure.
3 months before, would that be June or July?
Okay, so is she turning 65 in September? Is that what you're saying? Okay, now yes, so the 3 months we've got going backwards, we got August, July, June. So the 3 months would start in June. However, for original Medicare A and B, if she's already getting her Social Security, she'll be automatically enrolled in that. So for original Medicare, she'll be auto-enrolled. It's just going to be signing up for whatever she wants to do in addition would be what she would need to do.
She called the 1578 number.
Okay?
For the Medicare.
Okay?
Is that where she would call?
Our number, the 800-686-1578, absolutely. She could also make an appointment to come in and talk to the folks here too, if she'd rather do it in person.
Okay.
And they're a lot less busy in June than they are right now.
Oh,
Yeah.
So June. Thank you, sir.
Yeah, absolutely. And nobody if you know him, nobody say he just told us how old his wife is, okay? No one go and tell her, I should say, if you happen to know her. Don't go say, well, you know, when you're turning 65. Okay, I'll tell you what. Yes, ma'am. You have one more for me?
For the Part C.
Yeah.
Medicare, is it the same as A and B? If you choose not to change, you just automatically continue with the same?
Yeah, any plans, supplement, Part D, or Medicare Advantage. If you don't make any changes during open enrollment, it'll all just automatically roll over to next year, as long as it's available next year. Some of the Advantage plans and some of the Part D plans are actually not going to be available. Some not in Ohio, some not in certain counties. You would have got what they call an annual notice of change. It's supposed to come out before October 15th, but this year I've talked to some folks who said that didn't happen. Where one of the things they would say is, hey, your plan is leaving Hancock County in 2026. If you don't select a new plan, we're going to put you in this other plan. Okay, well, I'll tell you what. Did you have one?
Yeah.
Yes, ma'am.
If you have original Medicare and you switch to an Advantage for the next year, if you decide you didn't like the Advantage?
Great question. Let's say this. I'm going to answer a question very long-winded, slightly different way, so bear with me. What can I do? What can I do every year, right? Those of you who are new to Medicare, you can sign up for anything. You know, I like to say you're never going to be more popular with insurance companies than your first year when you're brand new to Medicare, right? Because they all want they want to get you right out of the gate, right? If they can get your business right out of the gate, hopefully you stick with them for the next 30 or 40 years, right? That's what they're hoping for. What can I do every year during open enrollment? So every year, I can go from original Medicare option 1 to a Medicare Advantage option 2. You can do that every single year. Pick any Medicare Advantage offered in your county. Every year, you can go from a Medicare Advantage plan to any other offered in your county. You can change that every year. Every year, you can go from option 2, Medicare Advantage, back to option 1, original Medicare. So you can always go back to original Medicare, and you can always pick up a Part D. So far, everything's good. What about coming back and picking up a new Medicare supplement, though? I switched, I went to Advantage, I came back, now I want to pick up a Medicare supplement. If you're not in a special enrollment period, if if you don't qualify for one of those, can I come back and pick up a supplement? And my answer is maybe. Because you have to answer those health questions. It's called medical underwriting, and they have to want to sell you a plan. Even your same company. Even if I left my company and I come back to the same company, they're still going to do it again. They're still going to do it again, and they might say, no. So what I don't want someone to do is jump over to Advantage because, hey, month to month, that's cheaper, and then you do have some major health issue. And by a major health issue, I'm saying things like I said before, cancer and heart disease and really bad stuff that, we don't want. And then say, you know what? I'm paying a heck of a lot in copays. I better jump back and get a supplement because it's going to be too late. I know it's a very long-winded answer to a short question, but that's what I wanted to go through. Anything else at all? Well, I'll tell you what. I will, it's going to be a process getting my mic off, but I'll turn the mic off. If you folks wanted additional books, there's a little stack in the back. What I got up here, I'm trying to empty my trunk out, by the way. We're getting close to the end of the year. These are magnets with OSHIIP's phone number. These are magnetic chip clips with our phone number. Please take all of it. Okay? Please take all of it. If you're saying, hey, I really want 2 chip clips, go for it. But I'll also, once I get my mic off, I'll be up here. If you had questions you wanted to ask me, you didn't want to raise your hand and ask everybody, come on up. Come on up and we'll go through that. But otherwise, I thank you guys for spending your part of your morning with me.